Hello, and welcome to my pediatric case study on autism. This case study is about a 2-year-old, MJ, who's being seen for a well check. MJ's parents are expecting their second baby soon. MJ was born full term and has not had any significant health issues. MJ missed his 15 and 18-month checkups and has not been seen since 12 months old. While in the office, MJ's vital signs, heart rate is 98, respiratory rate 22, temperature 98.4. The toddler is in the examination room playing with a toy truck. History, the baby rolled at 4 months, walked at 11 months, started babbling at 15 months, said mama, dada at 18 months. The mother denies the child putting 2 words together, like mama juice, daddy please, cargo. Baby is not doing those things. The mother also denies that the child responds to their name now. The mother states, I think he's going through the terrible twos because he used to listen to me, but now he ignores me sometimes. Autism screening should be done on all infants and toddlers. Some red flags to pay attention to that could be signs of autism. No babbling by 12 months. Not pointing or using gestures by 12 months. No single words by 16 months. No 2-word utterances by 24 months. And losing language or social skills at any age. So the RN continues to observe MJ in the exam room and has also noticed the following. MJ is just uttering sounds, not using many words. Repeating his version of truck, 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 over and over and over. MJ's playing with the truck in a hyper-aggressive way the entire time in the office. When MJ's mother tries to coax him to come sit on her lap and comfort him, he pushes her away. There's a lack of eye contact between MJ and his mother. There's also little change of facial expression in MJ. MJ needs to have a blood test done for checking for anemia, checking his hemoglobin level, and he doesn't cry. The RN also looks at the electronic medical record and notices that he did pass his hearing test when he was born because the RN is concerned that maybe he has a hearing deficit. And she also notices that the lead screening was negative on multiple occasions. So again, the RN is thinking, well, maybe the child has had lead exposure and is causing these behavioral changes. So again, following the nursing process, we always want to assess, then diagnose, plan, implement, and evaluate. So the RN has done a thorough assessment. It's time to diagnose. Following the scope of practice of an RN, the RN will not diagnose MJ with autism, but has enough assessment data to recognize that these are red flags and these are signs that need further evaluation. The screening tools for autism were positive in the office. So the RN notifies the provider. The child is referred to neurology and developmental specialists. The RN realizes that autism spectrum disorder is likely. The RN discusses the concerns with the parents about the significant delays that they are noticing in MJ's development. The RN and the provider discuss the plan for MJ to receive Head Start programming immediately. They also discuss with MJ's parents the need to receive services through the public school system at age 3 years old. So just because MJ is only 2, we don't wait to start talking to parents about their plan. So time progresses. MJ is hospitalized at 4 years old for a tonsillectomy and PE ear tubes. He has been since diagnosed with autism spectrum disorder, and he is receiving services through the school and the community, including speech therapy, physical and occupational therapy, music therapy, swimming therapy, and equine therapy. What nursing management should be included in MJ's care during his hospitalization? Well, the nurses are definitely going to talk to MJ's parents about what his routine is like at home. Children with autism very often like to stick to rigid routines. And when their routine is disrupted for some reason, it can cause undue stress onto the child. The RN will also talk to the parents about what they have observed of MJ's behaviors. The parents state that they see when MJ gets stressed, he does certain behaviors such as hand flapping and head banging. The RNs will be on the lookout for this while MJ is hospitalized to know that that could be a sign that MJ is feeling stressed, since he continues to be mostly nonverbal. The RNs will write a care plan which includes as much structure and routine during the hospitalization as possible. The RNs will also consult with the parents and ask them if they will be able to stay throughout the whole entire hospitalization. If the parents are able to stay, they of course are welcomed. Because of family-centered care, we know that children do better when their parents are near and can provide comfort. If the parents are not able to stay, or even if they are able to stay, the RNs will have a conversation with the parents about getting some probably much needed respite care, taking care of themselves. When parents have a child with autism in these young preschool ages, they can become very stressed themselves. So while the child is undergoing the procedure, you may want to encourage the parents to go out and just have time by themselves. You can assure them that MJ is getting the best care possible and that they should take some time for themselves. But of course, when they're ready to come back, we would appreciate them being by the bedside, and MJ would also. So some key pens up points about autism. Remember, in infancy and toddler ages, autism is often recognized that children are just not meeting their milestones, especially in the areas of speech, language, and social development. In the toddler age, many times autism is recognized as regression, especially in speech and language and social skills. Also, in toddler ages, signs of autism may include unusual behaviors such as hand flapping. And the last point about autism is that many times the physical development of the children are on track as expected, but the speech and language and social development is what is lacking. Thank you.